Welcome to Unhinged and On-Call. I'm Dr. Chelsea, your resident veterinarian.
And I'm Trish, a registered vet tech who's seen it all. Each week, we're pulling back the curtain on the wild world of veterinary medicine, from late-night emergencies to barnyard drama.
No filters, no fluff, just real stories, real laughs, and maybe a little emotional damage. Thanks for letting us share the madness with you. Well, welcome to the show, guys. We are continuing an international kind of theme going on with our podcast.
Yeah.
So a couple weeks ago, we had Dr. Dean Hendrickson talking about his kind of African work with essentially laparoscopy. Okay, I'll completely repeat that. His work in elephants in Africa.
Yeah.
And that was like enlightening.
So
cool to think about.
Yeah.
So it's actually like very fitting. I don't think we planned this, but to have a great guest on today, Arantxa. She's an LVT and also just gained her VTS in anesthesia.
Amazing.
She works at University of Tennessee currently, but has really like traveled the world doing spay-neuter work. And so I just think it's super like motivating for those of us who kind of, you get in your bubble when you're locally just getting through practice and seeing as many patients as you can and helping people, is just remember that like we can have a lot of impact across borders. So I think what's really cool is she's found, it sounds like actually, and we could probably get it from her, but found a small, essentially nonprofit to travel with, and she's done a lot of her work with that in spay-neuter, and you get to travel the world and see things, and I just always think it gives us such a better perspective when we come, and we laugh about it all the time being first world problems, but
right.
you kind of take for granted all the things we have here, the diagnostics, the ease of like getting patients to a referral center, or if you're at a referral center, just walking across the aisle, you know what I mean?
She talks about like a makeshift clinic, right, in our episode, and how they did that and set it up and accomplished everything that they had to with what they had. And that makes you just a better, not only technician and doctors, but just savvy all around, like working with what you have around you, which is really cool.
MacGyvering.
MacGyvering. Yeah.
And that's it brought me back. I actually forgotten all this, but I used to, I did a spay-neuter trip in like inland Mexico.
Cool.
Gosh, in undergrad at some point. And it was so cool. And there's a language barrier. I spoke Spanish.
Yeah.
But for all the veterinary terms, like I didn't, they can be close, and I kind of fudged it and got away with it essentially. But it was cool because we would just pull street dogs. There were owned dogs like she talked about. And it's really like you really get your medicine skills like very honed up when you have this stuff, because you can't reach for diagnostics, which I think and of course in the US a lot of times it's just easy because we have diagnostics at our fingertips, but gosh, so much of it comes down to your like physical exam and you know what I mean, and just your medical skills of palpation and history taking and figuring out all the things, and then like you said, working with what you have is amazing. So I guess just it's like making me kind of want to like go on some of those trips.
I know,
legitimately.
For
like
sure.
Belize anything. So I think
incredible.
So yeah, I just think it's kind of inspiring that you can use veterinary medicine to go places and help other people and their animals and travel.
Yes.
And you know, really kind of break out of like the day-to-day.
Yeah,
stuff.
exactly.
So,
yeah, that's so cool. She's so neat.
Yeah. Okay. Thanks for listening, guys.
This episode is brought to you by our friends at VetCS, your go-to for veterinarian-developed CBD and wellness products for pets and horses. Founded by veterinary professionals, VetCS offers science-backed formulas made with premium hemp extracts to support calm behavior, joint health, and overall wellness, whether you're in the clinic or out at the barn. VetCS is all about helping animals live better naturally. Want to see what they're all about? Head over to vetcs.com to explore their full line of CBD products.
Well, welcome to the show. Today we have Arantxa Lasa joining us, and she's currently at University of Tennessee. Thanks for your time today.
Yeah, thank you guys for having me.
Of course. Tell us a little bit about how you got into VetMed in general.
Yeah, so I originally thought I wanted to be a zookeeper. So I went to school and was kind of pursuing that route. And then when I graduated, I kind of didn't know what I wanted to do. I did an internship at a zoo in Cincinnati, the this zoo in Cincinnati, but it was kind of like I really enjoyed being a zookeeper, but like didn't want to limit myself to like one species or like herd or whatever, because zookeepers kind of stay with like hoofstock or they're with reptiles or whatever. And so I kind of like moved in with my parents, and I was just like, I don't know what I want to do. And my mom literally was like, hey, like this school has like a vet tech program. Like, why don't you do that? And I kind of wanted to travel like on my time where I was like in between going into being a full adult. So I started working at a vet clinic because I knew they would give me the time off I needed to travel. And I like had always wanted to go to Africa. So I booked a trip to Africa that was like a month long, which I would have never obviously been able to do going into like an adult job.
Right.
And then I was working at a vet clinic. So then when I like got back from Africa, I really realized that I liked working at the vet clinic. My mom had mentioned the vet tech program. So I applied to work or to go to school there.
Yeah.
And then I ended up working at a vet clinic all through my vet tech school. My school has like I think it's 8-week program in between where you do like your externship. And so I was actually assigned to Oklahoma State University because the vet tech program was in Oklahoma.
Okay.
So I went and did my externship there and then really realized that I loved academia.
Okay.
And then I've kind of just been in academia ever since, but like trying to mix like travel with VetMed.
Wow.
So it's kind of like my roundabout way of how I did it, but yeah.
Cool.
Well,
That is
and
great.
And you just mentioned, but you just got your VTS in anesthesia, I believe, right?
Yeah. Yeah.
Cool.
That was like it's in theory a 2-year process because you take one whole year where you collect cases and do like case reports, and then you submit that whole like application packet.
Okay.
Then you hear back if you get approved, and then if you pass the packet, then you basically wait for 9 months because the test is offered every September. And then you take the test in September. But like to apply, you have to have all of these hours. They have to be like 70% of the time in that specific, specialty that you're applying for, which for me was anesthesia. And you have to have CE that's like only for that specific specialty, and it has to be from only boarded people. So it's like really like a 5 to 7 year process because just getting the CE.
Yeah.
So
Yeah.
it was a long go.
Yeah, you started a while ago. Is that
Yeah.
At UT? Are you in anesthesia, or what's your
Yeah. So I'm lucky that I work 100% in anesthesia.
Wow.
So I don't really like, I talk to clients like maybe once a year, and obviously I love that, but some people like talking to clients.
Yeah.
But I talk to clients like once a year, and I'm literally 100% doing anesthesia. So it's pretty great. It's very specialized though. Like don't ask me about vaccines. Don't ask me about heartworm. I found out yesterday about a new heartworm medicine. So cool.
Gosh, I'm
great.
with you. I don't know anything about bird dogs and cats.
Yeah.
Gosh, that's amazing. Well, cool. It's awesome that you've kind of found your niche.
Yeah.
Yeah, I love it for sure.
Do you like what?
Sorry, you go.
you go.
No, you go.
Do you like Tennessee?
I love Tennessee.
Oklahoma? Okay.
Yeah, so like I loved Oklahoma State, like loved it. They are very, I don't know if you've ever been to Oklahoma, but it's very cowboy. It's very like country, especially Stillwater, which is where the university is. And so like I love large animal, and that's what I did before anesthesia was I worked in the food animal medicine and surgery department. So like in Oklahoma, they had one of the biggest like bucking bull owner names lived like a couple hours from Stillwater. So that's where all the bucking bulls would go. So I like absolutely loved Oklahoma. I think I just kind of outgrew Stillwater because it's just a very small town. It's like very good for kids and like families and things like that, but not very good for like someone in their 20s and 30s. So I actually just, one of the doctors I work with now came and did a locum at Oklahoma State, and he was kind of like, we're hiring. And I was like, oh, like I've been to Nashville. Like I thought it was cool.
Yeah.
And he was like, I mean, if you're really serious, like, do the interview, whatever. And I mean, my boss at the time at Oklahoma State was like obviously super supportive, and she knew that I kind of like wanted to leave more because of like the city than like the job. And then it just worked out great, and like Knoxville's amazing, and I mean Tennessee is just so different from Oklahoma. And like I've lived here now almost 4 years, and I'm like a baby now about heat. Like Oklahoma was so hot, and Tennessee is like more normal. And so I'm like, wow, you don't have to live somewhere that you like go outside and like the heat just hurts you. Like it just feels like you're walking into an oven. Like it's great.
Yeah.
So
Yeah.
I love Tennessee. And like seeing mountains. I mean, Oklahoma's so flat.
Yeah.
So yeah, I love it.
That's what I don't think I could give up from Colorado, is seeing mountains. Like I
just visited Colorado for the first time whenever Ivex was there. So
oh, nice. Good.
Yeah.
Oh, awesome.
It was my first time leaving the airport, I'll say.
Yeah.
There you go.
It is a world of its own,
it is.
DIA.
Yeah.
I will say Colorado people are like, like the Smoky Mountains aren't real. They're not the Rocky Mountains. And they were just like competing with me about the mountains. And I was like, listen, I'm from Oklahoma. Like all the mountains are mountains
They're
to
all
me.
great.
So
Yeah. They're all great.
yeah.
They work.
That's awesome.
What was your question?
My question was, what, I guess, out of anywhere that you've been and traveled to, what's your favorite place that you've ever been? Because you've gone to some.
Well, so like non-VetMed related, I love when I went to Mexico with my family, but that was like just literally because it was just like good vibes, good atmosphere.
Yeah.
It was like an all-inclusive resort, you know?
Yeah.
And then Africa was also not really VetMed related, but we were like doing volunteer stuff with the animals, and you could like, the people that came to Africa, you either picked like the animal route or you picked like the human route. So there are people that were like pursuing being doctors and stuff like that. So they like worked with the orphanages and like volunteers like that. And I did everything with the animal side of it.
Okay.
So, I mean, Africa was like absolutely incredible. But then as far as like just like hitting me in my feels, like making me feel like I was like making a difference and just like, I don't like truly just making me feel like I was making a difference. Like Argentina will never be topped. Like I presented in December at the University of Tennessee at our conference about just like VetMed abroad. And like I was like almost like about to cry just talking about Argentina because it was just like so great.
Yeah.
So Argentina was just amazing. I mean, please like stop me if I'm yapping too much.
No,
but
no, this is great. What did
we went
do specifically in Argentina?
So I went at the end of July, end of June, beginning of July. So we were literally flying back on the 4th of July.
Okay.
It was actually a rotation through the University of Tennessee. So we went with 4 vet students. One of our doctors that went is the doctor that works at the University of Tennessee. She's one of our shelter medicine doctors.
Okay.
And then the doctor that we have like the connections and ties to in Argentina, he used to work at the University of Tennessee as a food animal doctor.
Okay.
And so he's from Argentina, born there. So he wanted to move back to Argentina, but he really like wanted to show the students like rural medicine and just like working in like not perfect veterinary conditions.
Yep.
So he created this rotation, and then he's been doing it. I think the year I went was maybe the 3rd or 4th year. But he's been doing it. He takes 4 students every year, and we just like go and just literally go to like the most, I mean, they have no veterinary care. Like there's one veterinarian in the entire town, and she does small animals, she does large animals, she does house calls, she has her own little clinic. But like we were going like super far to like provide support, and we're working with like owned dogs, not owned dogs, and like we literally were set up, like one of our locations was outside of someone's house. They just put together like some tarps because it was super windy that day and also like pretty sunny, and we're just setting up like folding tables as surgery tables. And we set up like a folding table as like just reception, and then like a vaccine table, and then like a prep table where we're placing catheters and stuff. And in Argentina, like there was a pretty big language barrier for people that didn't speak Spanish, but the students were like catching on so quick, and like they were just like, I mean, some of the people spoke English a little bit, but it was just so cool to see like how we could translate. Like I am not a surgeon, obviously, so I'm like trying to teach the students where they need to ligate and where they need to cut just by translating from what the surgeon is telling me to tell them. And they also
Your surgeon didn't speak English?
One of them did not. The other one spoke like very, very minimal English, like just very minimal. And then the one that's from Argentina that worked at the University of Tennessee, obviously he spoke English. And the one that we took from UT to Argentina, the shelter medicine doctor, she speaks Spanish.
Okay.
So it was like pretty good because between me and her and him, like we would kind of like bounce around and translate. But like I was there, like, I mean, I was obviously there to provide mostly anesthesia support. So like whenever the students were working in like the section where they like go and do intake and stuff like that. Like they were just kind of having to figure out how they could play charades or like whatever. But it was great. I mean, and the students truly did so well. Like I'm so proud of them. So
That's a cool rotation.
That's like super
I'll go back to school to do that rotation.
yeah.
Wow.
I think we did like 175 or something spays and neuters, but that's not including like just normal appointments that we saw.
Okay.
And I mean, like we saw an appointment that was a bird that the owners had just been feeding like bread and like other random stuff that the family ate.
Right.
So the bird was like, I mean, it was pretty fat for a bird, which I learned because I don't know about physical exams on birds.
Either.
So the students were like teaching this person just like bird husbandry, and like the bird was really stressed out because it lived with a bunch of little kids. So it was like trying to live on the sleep schedule of the little kids and then being like awake all night.
Yeah.
So it was crazy. Like we saw a bird, we saw a goat, we saw a steer. I mean, we saw all kinds of things.
That's cool.
It was really cool.
Man, that permanent veterinarian there that's just by herself.
Yeah.
Does she have anybody else, or is it literally solely her? Like, does she have a tech or extra hands or?
She has someone. I don't think she would qualify as a tech.
Yeah.
Because I truly think like she was kind of like her receptionist, but then would assist her in surgery, but not like a formally trained, like had any kind of knowledge in veterinary medicine before working with her. But like very helpful for sure. But she has her own like radio show.
Wow.
And so like you probably could find it. I don't remember what it's called right now.
Yeah.
But we were on the radio show. It was really cool.
Oh
And
gosh.
I mean,
Okay.
this lady, like A, is like the kindest, nicest lady you'll ever meet. B is just like the strongest person you'll ever meet. Like she had a radio show. She had her veterinary clinic.
Yeah.
She also teaches like part-time at one of their schools.
Wow.
She's insane. She does all this stuff. But yeah, she's by herself pretty much.
Wow. That's
Yeah.
incredible. That workload
That's
is
cool that
crazy.
it talks. Let's read the list
Yeah.
for listeners. Like Arantxa has been to all these cool places doing VetMed. And I think it's cool because part of our show is like also turned into showing students how malleable like VetMed can be and what direction you can go in. But
And we have that you've been to Hawaii, St. Croix, Belize, the Marshall Islands, Cambodia, and Argentina. And then now you're obviously in your role at Tennessee, but that's a lot.
Yeah.
Like,
oh, can I ask about can I ask about your like the Belize Zoo? Position, or trip and
So how I actually got into VetMed like abroad was on a Facebook post. Someone shared it and they were like, "Hey, anyone want to go to this?" And that was the Hawaii trip.
Okay.
But like I have no kids. I was like, sure, like I've got nothing to do as long as my job gives me the time off.
Yeah.
And I didn't even know if it was legit. Like truly, I was like,
yes, we could show up. I love that.
Okay. Now
Yeah.
surfing.
Yeah.
So I got into that. I get to Hawaii. It was legit, thankfully. And then I met someone there that she actually has her own like spay-neuter nonprofit. And she was like going to see kind of how other companies did it, like how they fundraise, how they do that, because she was growing hers.
Okay.
And so she was like, "Hey, come on one of my campaigns with me." I was like, absolutely. So the next year I went with her, which is how I went to Belize for the first time. And then pretty much ever since, besides my one Belize trip with UT and the Argentina trip with UT, like I've almost solely gone with her company.
Wow.
So that was like Cambodia and Marshall Islands and all that stuff.
Okay.
But yeah, that's how it started.
Wow.
And then, so as far as like the Belize trip with UT, that's like a very established rotation at UT. They always take their zoo medicine doctor and then probably the intern or resident. It just kind of depends. They try to take someone every year. And then they'll take, like they usually take a ClinPath person because they are reading their own slides there. And obviously like it's the best to have someone that does it every single day.
Yeah.
And then they were taking one of our anesthesiologists, and then that person had gone for like a bunch of years in a row and kind of wanted to step back from the role. So that's when it got opened up to the technicians.
Cool.
So myself and one of my other technicians that I work with are the two so far that have gone,
Okay.
but they go twice a year.
Okay.
And then it's like I think it was like a 9-day trip, but I think work days, it was like 5 or 6 days.
Okay.
And it was really just like we were working alongside the keepers at the Belize Zoo, and they would tell us like we have all these appointments lined up for you all for the 5 days that you're working. These are the animals. These are like the problems that we're having. And then there was like wild stuff in there. Like one of the days were called out to see an injured tapir, which have you seen a
I've worked
tapir?
on a tapir. Yeah.
Cool.
Yeah.
I never knew what they were like, never knew what they looked like, but we're like, okay, cool, like an injured tapir. So we set up the car to like go like get a wild tapir that's like allegedly allegedly running around the town. Okay. And it's injured. So I'm like, okay. Well, and we like go and they were like, don't be like shocked if it's not a tapir. I was like, what do you mean? Like a tapir is like very big and like different.
Identifiable.
And we get there and the zookeeper, like the head zookeeper, gets out of the car and she goes to see what's happening. And I just like see her come back laughing and shaking her head. And it ended up being a tamandua, which is like a little like sloth-like animal.
Oh my God.
So like not a tapir at all. They don't look the same at all. It's like significantly smaller. So we were just laughing about that, but it was cool because we saw that. And,
Cool.
That's so cool.
Yeah.
Did you have to? Were you able to help it, or was it actually injured even?
No, it was we think it had like a hemoabdomen. I think that it got attacked by a dog.
Okay.
It was alive when we took it, but by the time that we got back to the zoo, it had unfortunately died.
Okay.
But it was still like a really cool experience to see. And then obviously like all the zoo animals, we were definitely able to help. While I was there, we helped like a tamandua baby. We had a tapir baby. And then we also had like a bunch of different birds that they had. We saw a spider monkey. We saw a puma.
Wow.
So there was quite a lot of things that we saw. And if you ever go to Belize, you have to go to the zoo. Like it's just like not your typical zoo in the US. Like it looks like you're just walking through the wilderness of Belize. It's just so well like done.
Wow.
So it was really cool.
And they don't have a dedicated veterinarian there?
So the dedicated vets are actually 3 different veterinary schools that come like at specific points in the year. So UT goes twice a year. And then I want to say, I'm not going to say the other schools because I honestly don't remember who they are and I don't want to misspeak.
Sure.
But I'm pretty sure 3 different schools come.
That's cool.
So, yeah. And then all the students get to.
I know.
This is like a great
company
reason.
right off.
Let's go to the zoo.
Yeah.
And it's super easy to get to, like super cheap. So Belize is great.
Okay. Wow. So out of all the just anesthesia cases that you've done everywhere, do you have a standout case that was like your favorite to run? Or was it or scary or difficult? Yeah, just like that challenged you, I guess.
Well, I was actually thinking about this, like with this call upcoming, and like this is not anything cool that like I did that like made this animal live or like anything. But we had a bucking bull at Oklahoma State that we were anesthetizing. I do not remember for what reason. But we have to anesthetize them in their stall because they're just like pretty dangerous to like walk to our surgery OR.
Yeah.
And so we usually dart them, which not with like a typical like blow dart, but we just have like a pole syringe that's just like long and you can just give the injection. And we can like squeeze them into the stall into like a chute type situation. We just don't catch their head. So they're not like flailing around or anything. It's very calm. So we injected him with his anesthetic. We lay him down, we intubate him, and then we put him on the hoist. And as the hoist is all the way up as high as it can go, we're like about to put him down and the hoist stops working.
Oh no.
So it was like a little bit of a panic.
It just froze.
Oh yeah, it just stopped working, and he's like upside down.
Upside down,
and
highest point.
So the way that I hold their heads up, because the head weighs like a lot, is I loop it through like the part of the hoist where like their leg is, and then the halter kind of holds it on. So because of that, his IV catheter didn't work because it was occluding his ear with the halter being so tight. So I just put a needle in his jugular vein and attached an extension line. And we were just giving drugs to keep him asleep until they could figure out how to get him down.
Oh my God.
And we got him down and nothing was broken. Nothing happened to him. His surgery was successful. The hoist was fine. But it was just like that like 10 minutes of panic where we were like, how do we get him down from like all the way up there? So
an aspiration too, like from the rumen and stuff. Or
yeah. And I mean, thankfully he was intubated, but yeah, definitely still.
oh my god.
It was really
I
cool.
like how you preface that with, I didn't do anything
Yeah, I didn't
special
do
to
anything.
save him, and literally saving his life.
Well, I guess, you know, he wasn't like under anesthesia and we did like a bunch of stuff. Like,
Oh my god.
yeah.
Upside down.
But that was probably my most fun time. My Apple Watch was like, oh, your heart rate is really high right now.
You need to take a few breaths.
It's time to sit.
Yeah.
Oh my god.
And I was with one of our anesthesiologists who's from Italy, and he's just like, I'm so sorry, my dog is drinking water. If you could hear him.
Fine.
We're
You're
used to it.
we're on the right.
But our anesthesiologist is from Italy, and he's just like the most hilarious man. So we were just like both like bebopping around, and his anxiety was probably like 10,000 because he's just like
Yeah.
that, and it was so fun. Like as fun as that situation could be.
Yeah.
That's actually
But-
what's our second voice breaking
Yes.
issue,
That's
which
true.
in equine surgery I've done a fair amount, like, and not had a voice
Yeah.
break. But
Yeah.
shit, like
Yeah.
now I think the voice companies need to
I think our
listen up.
I think she said they cut. Did they cut that one?
Well,
down?
yeah, but
he
that
was low
horse,
enough.
it was a horse that was in the middle of night cog surgery, was low enough that they could just cut through the leather like cuffs essentially.
Yeah.
But
I mean,
Unreal.
after that happened to me, I was like, I think my biggest fear is that happening to a horse.
Yeah.
Because like bulls, like I love
they're-
horses, but they're just more sturdy. Like
Yeah.
bulls are
horses are not
you know,
built well.
Oh.
yeah. And like when I first started working in anesthesia, I mean, I was basically like white knuckling a ketamine syringe because I was like so scared of horses waking up,
Yeah.
and just like horses were like my biggest weakness. Like I was so scared of them.
Yeah.
So I was like, oh, okay, if this happens with a horse, like I'll die.
Yeah.
Yeah. So
I'm dead.
How did you recover that bull? It went back to its stall
Yeah.
to recover?
So like when we got him down, we rolled him to the OR and still like did the surgery, which
Yeah.
again, like I don't remember what we were doing. I want to say it was probably like they do like one of three things that we would go to surgically. Like they'd either have like a broken bone of some sort in a leg, or they would have a horn infection.
Okay.
Or like I saw a few that had broken jaws from like fighting with other bulls. So I know it wasn't a leg because all four of the legs were hoisted.
Yeah.
So it's probably like a horn infection that we were anesthetizing for, honestly. So we took him, did all the things, and brought him back. And like, have you ever like seen a bovid recover from anesthesia?
I've
No,
never laid
I
one
haven't.
down. I've all my
It's like-
NCAs and like C-sections have been standing. So no.
It's like 10,000 times better than a horse.
What?
Like you just lay them in sternal.
Fucking horses.
They just literally lay there, and they don't try to get up until they're ready. And even like bucking bulls, like you extubate them and they're not like aggressive when they wake up. Like they're just like, okay, I'm sedated. Like I can't get up yet. I can feel that my legs don't work.
They're smart.
And
They're smarter about
they're
it. Yeah.
very smart. And when they get up, like they're truly ready to get up.
Wow.
I've had one wake up. Like I've had one wake up poorly, and it wasn't a bucking bull. It was just like a little calf. And it was because we had him like pretty light. So we couldn't get him like into sternal and ready before he was like trying to be more alert.
Yeah.
So he just kind of freaked out and tried to get up. But like, that's almost the only time I've had anything bad happen.
Rolling
Wow.
into sternal.
Yeah. That's so nice. It's just like waiting.
Oh,
Make a difference.
yeah. It's like 8 people. It's like an 8-person job.
I was
But
gonna say that's not
Please.
easy.
Yeah.
I did a fair amount of bucking bull work in Wisconsin.
Mhm.
And we had chutes and really good hands that would tie them all down and
Mhm.
stuff. And that was for like true infections and sickness and stuff like that. But with Dr. Holt at CSU, who I've tried to make getting on the show, he has a big bucking bull patient caseload, I guess. And they come in for acupuncture like all the time.
Yep.
But they were pretty nice to work on. Like they were in a squeeze chute, but you would just acupuncture them, and literally easier than
I mean,
Yeah. Yeah.
oh, yeah. And like the scary ones to work with are like the really young ones that like
Yeah.
don't know their job yet.
Yeah.
And the like cows, like they're terrifying.
Yeah.
I would rather work with like a bull
bull
over a cow anytime.
Yeah.
Yeah.
And so those were like the really scary ones. And then like the ones that were like old enough, they like knew they aren't like in a bucking chute.
Sure.
They aren't at the PPR.
Yeah.
Like they're just there. I'm not saying like I would just get in a stall with one, but like
No, but
they were definitely much more handleable than you would
Easier
think.
to
So
work with.
Yeah.
Yeah. Right.
yeah.
Wow. That's incredible.
that's cool
So
about
cool.
recovering.
I know. I
Yeah.
would have never thought.
Yeah.
That's so neat.
Yeah, I loved it. It was probably the saddest part about leaving OSU because we saw a bucking bull just the other day at UT, but it wasn't, it's not like a common occurrence for us because it's just not like a big rodeo area because we're like definitely in the city, you know?
Yeah.
So,
Yeah, that
Wow.
would be rad.
So neat. Oh my gosh. Thank you so much.
Well, yeah, thank you for your time today. This has been great.
So cool.
Yeah.
Oh, man.
no, I'm like, let me yap. I can yap all day.
Well, I was gonna say we'll probably have to do like a part 2 episode with you and talk more about stuff because I'm sure you've seen so much. So.
Maybe your audio will work.
Yeah. Stuff. Yeah. Oh, good.
Cool. All right.
Oh,
We've maybe got it down now.
Yeah.
One of these days we'll get it.
Amazing. Oh my gosh.
Cool.
Thank you so much, Arantxa. It was so nice to meet you.
Yeah.
Thanks for listening, everybody. We would really love to have you as a guest on our podcast. So if you have any fun stories to share with us or would like to be a guest, we have a form on our website. So Unhinged and On-Call Dr. And you just click on the little link there and you can fill out a little bit about your story and yourself, and then we would get back to you. Or you can just email us to chat@unhingedandoncall.com and just tell us a little bit about yourself. And we would love to have you as a guest. We also are looking for ratings. So essentially on Apple, Spotify, wherever you get your podcasts, you can rate and review our show. And that would be super helpful in just getting kind of into the algorithm. And then additionally, we are on YouTube. So if you ever want to watch videos, we put more content, like visual content, so pictures, videos, things like that, into the episodes. So we'd love to have you follow or subscribe our channels on YouTube. Yeah. Thanks for listening. Thank you. Thanks for tuning in, and make sure you subscribe so you get all the latest updates. Unhinged and On-Call isn't just a podcast. It's a lifeline for every veterinary professional barely holding it together with vet wrap and caffeine. Somewhere out there, another tech, vet, or assistant is deep in the same chaos, dodging poop, managing meltdowns, and wondering if they're the only one unraveling. You're not. Whether you're laughing, crying, or rage cleaning your truck, you've got a whole tribe behind you. You're unhinged, but never alone.